What we always have to keep sight of is that we're dealing with one of the worst, most dire moments in a patient's life and their family's life. It's a situation that they've never been through before, but we've been through on a daily basis. And what I'm very proud of in our group and working with Dr. Walsman is how we take care of the patients in a very comprehensive way and try to achieve the best outcome in every particular case.
I believe that we have a unique perspective as dual-trained neurosurgeons to offer both the open neurosurgical procedures and the endovascular procedures. We really have a non-biased perspective in offering whatever the best treatment paradigm is for our particular patient.
Especially with vascular neurosurgery, it's very difficult to know what the right way to go is as far as surgical treatment, endovascular treatment, or just observation. But the decision-making, I've noticed, becomes very easy if you put a family member or a loved one in the place of that patient. And very quickly you find that you'll just know the right answer for that particular patient.
We've always been on the cutting edge of technology, always bringing in the latest technologies and offering them to our patients in a meaningful way as soon as they're available, even before they're available in the case of some of the clinical trials we've been a part of.
One aspect of our practice that I'm particularly proud of is our outcomes after patients suffer a ruptured aneurysm, which is can be one of the most technically challenging things to treat effectively and achieve a good clinical outcome. Approximately 88% of our patients who suffer a ruptured brain aneurysm go on to have a good outcome, disability-free, and living a very functional life.
We've had many cases where patients have had failed procedures elsewhere, and patients have been referred to us, and we've come up with a better plan that was effective, and the patients are doing well after successful subsequent treatment of their aneurysm. And that's something that I'm quite proud of.
Both of us have been dedicated to the care of the patients in our community, and that's actually a very significant source of enjoyment for us. I've even ran into a patient of mine who had a ruptured brain aneurysm while at the gym, and we exercised together for about 15 minutes, and it was one of the highlights of my career.
I have one patient that had a stroke about 10 years prior and saw a specialist at NYU who told him his aneurysm was not treatable, and I thought he was an excellent candidate for a flow diverting procedure. We did the procedure successfully, and I see that patient all the time in one of my synagogues in town. Very satisfying. We're very proud of the practice that we've built, and we're very proud to be able to serve our community.